So, welcome back. This is part two. If you haven't seen part one, go ahead and watch it. It's not very long. I'm trying to keep these videos kind of short. And I didn't want to put it all in one video because then that can go really long. Um, I'm trying my hardest, just so you know. I did not say a lot, but I can't help it because again, I didn't write a script out. So that is just how I talk. I mean, if you can't get past that, I guess move on. Okay, so moving forward, so my last post I did talk about my teeth issues and so forth. Again, it's like a never ending story, and I apologize for that. So then another health issue I have been mainly dealing with is I've been dealing with a lot of symptoms related to POTS, POTS. Now, if you guys don't know what POTS is, you may have to Google that because there's a whole video I can talk about what that is. And there's a whole slew of symptoms when it comes to it. It is basically, I think it's post orthostatic I guess, something syndrome or whatever. So, yeah, basically, my symptoms, and now I may not relate to you, or if you have it, comment down below because it'd be great to know other people may have it as well. I know there's a whole community. So, yeah, so my symptoms I have is the whole I'm like a feeling of faint. I do a lot of self-regulating. Like I ended up like swaying. I ended up um I have to constantly, cross my legs to keep from feeling like I'm gonna pass out. I feel like I'm gonna pass out a lot if I stand longer than a few minutes, or am I walking longer than a few minutes. Sometimes I just feel like I'm gonna drop any moment now. Sometimes even when I'm sitting, I feel like I have to go all the way down to lay because what it is basically my blood is pulling down and I got no blood flow to my head to keep me from passing out. So it's like the feeling of lightheadedness. It's almost equivalent to if you were to hold your breath and you were to like you hold your breath for a long, long time and then you let go of it, that feeling that rush you feel. Well, it's this kind of equivalent to kind of how I feel sometimes. Not just that, I have the fast heart rate. Even though it's not fast enough to basically diagnosed, but I have every single symptom, and I'm just gonna basically call it. I mean, even my family members are going to call it that I have it, even though I've done the only diagnosed test, definitive test they can say for a doctor to say yes you have it is what they call a tilt table test. Now look that up. It's a tilt table test. It's simple. You literally just stand on this little on you. There's just like a bed and there's like a little thing on the end of the bed where you just kind of stand and they kind of strap you down, but you're kind of loose though, but you should get strapped down so you don't fall. And they hook you up to an IV and then they hit I believe the EKG thingies on you, if I'm not mistaken, I can't remember. And then they just kind of basically they lay you completely flat. You start laying flat and you kind of just tilt standing upward. Problem with me is I don't think mine was actually over. You have to go up. Your heart rate has to, within 20 minutes, your heart rate has to increase like 30 beats per minute higher than your resting heart rate. Problem is that mine missed the marker by a couple of beats. And so the doctor, and I wasn't really happy about him, he basically just said, oh, I'm just going to say you don't have it. Okay. So, um, I mean, but I had every symptom. And I think the reason mine didn't have it, it didn't go up high enough for them to say I had it, was because I believe of, because when you clench your thighs or your legs, that's the whole point. You're pushing the blood flow back up. So when they stood me up, I was at a weird position enough where I was literally felt like I was in a half squat mode almost, like not quite, but so my thighs were clenched. So of course it's gonna push the blood flow up. And it was hard for me to explain to them I need to be readjusted because I feel like I'm clenching and the nurse kept saying, oh no, you're not gonna fall, you're good. I'm like, I don't feel so I just stayed like that for 20 minutes. And by the time they raise me back down, I felt a sense of relief because those muscles were like so clenched during the standing. So of course I'm not getting an accurate readout. So it is what it is. Preparing for this test is ridiculous. I had to um, fast the night before, which is horrible for me. I hate fasting. And then I have, then I had to get up, be there at basically dawn, and then 2 hours before they started the test, I got to be there. Why? I don't know why. But I mean, I got there. It was at a main hospital. I got to the main hospital, and then, uh, what else did they do? Yeah, and then they got me. Then when they got me back, my family couldn't go back with me. I had to go back by myself, and then I ended up sitting in this little bed, makeshift bed. I guess it's almost kind of like in outpatient surgery, day surgery area. Um, it's different for me because I don't remember the last time I was even in an area like that, but it kind of remind me of something like that. So, and I was back there and they hooked me up. I mean, nurses were great. Everyone there was perfectly spot on fine. Um, it was interesting. That's all I gotta say. It was just the doctor himself can care less. The nurse did more work with me than the doctor did. And this doctor is not my regular cardiologist, because my normal cardiologist is not certified to do this test, which I don't see a whole lot of certification needed to do this test, um, but yeah, so basically the test, in the middle of the test, you after you stand up for so many minutes, then they end up the reason for the IV is possibly in case they need to give you something happens, mid of the test, they already got an IV started because things can happen. Also, they're going to inject nitroglycerin, which that may sound familiar to you if you had somebody who had a heart attack or heart disease or something like that, and that they would give you like a little tablet, put it on your tongue, and it literally helps. You know what it does? It kind of resets the heart rhythm. It kind of brings the heart rate down. Problem is though, I guess he made that call not to give me nitroglycerin way before I got started on the test. Why, I don't know. But my blood pressure, and I normally have low to regular blood pressure. My family knows this. My regular doctors know this. Being there, my blood pressure was sky high, and I didn't have anything to eat or drink, so there was nothing in my system to cause it to be that high, and except for maybe anxiety or stress or something. But it was it was really uncalled for. It was like, I'm surprised he didn't say anything about it. But then again, like I said, the nurse was caring for me more than the doctor. I saw the doctor maybe a total of 5 minutes. He walked in, he's asked me how I was doing, looked at all the hookup that the nurse did. He didn't do anything. And then was too busy walking in and out of the room to go do something else. And then he comes back 15, 20 minutes ago, asks me how I was doing, and then leaves, and then comes back again and then says, okay, well, we're done. Like, and my insurance is paying you how much? I mean, and because this test is very expensive. So, but it's the only test you can do that defines on like definitively whether you have it or not, which I think is ridiculous because there's so many other symptoms. And if you have unexplained uh the issues like I have and there's no other explanation, you've gone to all many specialists, regardless if you have the high heart rate or not, this should be what I'm going through should be enough. So I'm disregarding what he says. So I believe I do have it. I'm treating myself as if I do have it. And it's hit miss most days. There's no cure. You can only try to manage it. You're gonna have more bad days than not. But the best we can do is lots of water. Raise your salt levels a little bit. I have these salt tablets I bought on Amazon, but I I took it one time and it messed me up a little bit. So I think it's because I took it. Then I also ate my additional salty foods and it gave me too much and my blood pressure was too high and I felt really weird. It went, so, and I ended up going to the ER on that because just to make sure, because my heart felt like it was flip flopping. So I was cleared on that. So I eventually calmed down because I guess I excreted it all out and my body used it up. My poor kidneys, let's just say that. But they just, so instead of using the salt tablets, even though I got a whole big old value size bottle, I decided just to just drink more water, watch my electrolytes, definitely, and count my, the sodium levels in a lot of my foods as much as I can, and rest when I need to rest, listen to my body, do a lot of the physical things you can do. Like I literally like clench my thighs. I cross my legs a lot when I'm standing. I will sometimes, if I need to, I will like squat down if I'm standing in line. It looks like I'm just squatting. But like some people that say their feet hurt, so they just want to sit down, so they just squat. I sometimes will do that. Or I lean if I can, like on a basket if I'm not shopping, or on a counter if I can. If possible, if I need to, if I have to, I will get one of those little motorized carts and use them. See, when I was younger, I used to be like make pass judgment on people my age with no physical issues, and they're not even old. Like, why are you using these carts? Why are you now? I'm eating my words. I'm like, now I need to use them sometimes because I may be having an off day, and a lot of it, not only that, it's also dizziness. Equilibrium feels like it's off. I feel like I'm drunk sometimes. There's a lot of times I'm not driving hardly anymore. I miss driving. I have to rely on my husband or my my other relatives sometimes. And I rely a lot on deliveries. Yes, I do tip, but as much as I can because I don't feel like comfortable enough to go out and, you know, drive in the condition that I'm feeling. But it's not just for my safety, but other people's safety as well. Because if I am feeling off or drunk, there's no sense in me getting in the car, even though I'm not, and then potentially get pulled over or cause a wreck when it could be. It's better for me to just make that judgment and just stay home. Now, there are times when I want to get out, and if I don't feel comfortable driving, I will just tell my husband, "Hey, you do the driving today, so I can still get to where I want to go or need to go." And now it's getting to the point where we go out and we're like, "Oh, because I want to go out." I'm sometimes some days mentally, I'm like, I only go out because I need to go out. And I'm trying to work on that mindset because this is not going to go away. There's no cure for this. I have to somehow find a way to manage it and try to work through it. There is some medications, some prescription medications some doctors can give you to kind of help, but again, unless I'm an officially diagnosed, they're not going to give me anything. I had a follow up with my cardiologist coming up, and my original one who ordered this test with this other doctor, But to me, what's the point of going? I cancel that appointment because there's no point in going, because that doctor is going to be uh he's just going to just reiterate what the other doctor told me when I went to go do the test. He told me, hey, I don't feel comfortable in diagnosing you this. So just do what we talked about, increase your salt and so forth. I'm thinking, if I don't have pus, then why are you telling me to do these things? What it is because he thinks I have it, but I don't have it enough for him to write it on paper because I don't have the black and white text when it comes to actual definitive diagnosis. So yeah. So there's no point in me going back to my regular cardiologist when it comes to this, just to do a follow up, just for me to get out and go, to the office. All that time wasted money because I have to pay for parking half the time, and go and just kind of talk to them and tell them to tell me, hey, you know, you don't have it, so I guess just seek other doctors or specialists or whatever, because I haven't, apparently. So, anyways, guys, that is pretty much what I'm dealing with as well. If you have POTS or you need to learn more about POTS, just Google POTS. It should come up, or POT syndrome. It should come up as well. And if you do have it, comment down below. Let me know. It'd be great to get a little community going and get some pointers and tips. And if you don't, or you have similar symptoms, if after you Googled it and looked it up, you know, then, maybe I guess educate yourself and see maybe bring it up to your doctor. Again, this is not for any medical advice or anything like that. So this is just my issues and what I've been dealing with. So yours could be totally different. Do not take it because you have similar issues I'm dealing with. You may not have POTS at all. So please do not diagnose yourself at home. Please do not just go out there and buy some salt tablets and take it or whatever it is because I said so and it helped me. Please do not increase your salt intake because it could cause a lot more issues than not. So, if anything, just drink more water. But definitely go see your doctor if you do think you have some of these issues and you think it may be related. So, with that being said, guys, thank you for watching and stay tuned for part 3 of my health issues. I'm dealing with another whole issue. So, thanks for watching. Stay tuned, and I will see you guys in the next one. It probably won't be posted today, by the way. So it will probably be posted maybe another day. But yeah, stay tuned. Bye.